Welcome to the Eurobodalla Health Service webinar. Thank you to the 44 participants we have online. Welcome. We're very glad that you could join us for this evening's online session. My name is Renata Sheehan, and along with my colleague Becky Bergman, we will be facilitating this evening's session. On behalf of all of us, I would like to start by acknowledging the traditional owners on the lands upon which we are variously based this evening. Meet and pay our respects to elders past, present and emerging. I'm very pleased to introduce you to tonight's panel. Margaret Bennett, the Chief Executive of Southern New South Wales Local Health District. Meegan Connors, the Coastal Network General Manager of the Southern New South Wales Local Health District. And Matt Malone, the Senior Project Director for Health Infrastructure. Before we commence, a little bit of housekeeping. So as I mentioned, we have now 47 participants online, so welcome. And all participants are on mute. You can submit questions using the Q&A function, which you'll find at the base of your screen. Your questions will be put to the panelists throughout and at the end of the session, of course, time permitting. The information sessions are being recorded. Videos of the sessions will be available on the project website early next week. Without further ado, I'd now like to hand over to Margaret Bennett, Chief Executive of Southern New South Wales Local Health District.
Thanks so much, Renata. Thanks for getting us underway. Look, good evening, everyone, and thank you so much for taking the time to join this session tonight. I'm really delighted to welcome you all, and I'm very appreciative of your interest and your advocacy on behalf of your community. As you're all aware, we had very much hoped to meet you all face to face, but the challenging COVID environment continues to evolve, and so we needed to make this change to the virtual session. But we're very much looking forward to having face-to-face sessions with you all as soon as it is safe and appropriate to do so. I'm very grateful for the more than 40 questions we'd received in the lead up to this session. And as I hope you'll hear, we've been able to take your questions and frame our responses tonight around your questions. So I hope that the next hour will be really useful in assisting to address some of the key issues that are front of mind for you all at the moment. We'll update the frequently asked questions at the conclusion of this week's sessions, and we'll send you an update by email, and then we'll post the update on the website. In getting underway, I'd like to welcome Dr. Alan Hawke, AC, Board Chair of Southern, and the board members that are all in attendance. Welcome, and also to the Chair of the Community Consultative Committee for the Eurobodalla, Brad Rossiter, OAM, and the Community Consultative members. On the panel today, as you've already heard, we've got Meegan, our wonderful General Manager of the Coastal Network, and Matt Malone, who's the Senior Project Director with Health Infrastructure. We're also joined by Catherine Lyons, who's the recently appointed very fabulous Site Manager, Director of Nursing for the Eurobodalla. Without any further ado, I'm just going to cross to Meegan and then to Matt, just so that they just introduce themselves before we get any further underway. Thanks, Meegan.
Thanks, Marg. Good evening, everyone, and thank you for taking the time to come out and meet with us today, as Margaret has alluded to. So for those of you that I've not yet met or I'm yet to meet, I am Meegan Connors, the General Manager for Coastal Network of Southern New South Wales, and I've moved to the coast in April this year, and my husband will join me in the next few weeks, which is very exciting. I'm absolutely delighted, to be here, and I look forward to living in and working with the community and being part of the journey ahead.
Fabulous. I'll hand to Matt, please.
Thank you very much, Margaret. Hello, everyone. My name is Matt Malone. I'm the Senior Project Director with New South Wales Health Infrastructure. By way of quick introduction, I've been working on this project now for over 12 months. It's a very exciting project, and we're certainly excited to have seen it develop so far and what there is to come as well. A quick note about myself: whilst I'm not a local to the Eurobodalla, I live in the Milton-Ulladulla region, but spend a fair bit of time in the Eurobodalla region when not working. mainly chasing youngsters around to sporting events at the weekends, though, when not in lockdown, of course. Thank you very much, Margaret.
Fabulous. Thank you both. So look, our plan for this hour was first of all to introduce the team. So we've done that. Answer as many of your questions as possible, and by doing so, to give you a good sense of the plans for Eurobodalla Health Service as a whole, and then of course to give an update with regard to the new hospital and where things are at. Look, but before I get underway with that, I just want to give a quick update with regard to COVID. There were some questions that came in seeking clarification, and in reality, there wouldn't be any health information forum anywhere in the country at the moment on any matter where there wasn't an update with regard to COVID. So look, the main things I would say, of course, is that the pandemic has certainly created an incredibly challenging time for us all, and we've still got quite a journey ahead of us. It's anticipated that the next 4 months will be particularly challenging in New South Wales. So Southern's website has all the up-to-date information you might need about testing, vaccination, new cases, sewage testing, venues of concern. And importantly, it also provides you with an opportunity to ask any questions or seek any clarification. Our overall focus continues to be on testing and vaccination, and really importantly, on our agility and readiness to respond. Every day presents a new challenge with COVID. So this is a challenging, evolving pandemic, and it's fair to say that it's taking an impact on us all in different ways. We've got some very exhausted staff, and we've obviously got the responsibility of supporting a worried community. As you would expect and imagine, our staff are doing a most remarkable job going above and beyond to keep the community safe. Our public health staff, for example, are supporting the intense contact tracing underway in other districts of concern, particularly the 6 LGAs of greatest concern. Currently, we've got 6 COVID patients in Southern, 3 in Goulburn, 2 in Queanbeyan, and 1 announced yesterday in Dugong. The detection of COVID fragments in sewage at several sites across the district, most recently Merimbula and Cooma, where we don't have confirmed cases, is of concern. Hence our constant call out to the community to come forward for testing, even with the mildest symptoms. Our facilities, as indeed are all facilities across New South Wales, are on red alert and fully prepared for COVID presentations. I won't repeat what's on our website, but we are offering a range of vaccination options, including new AstraZeneca walk-in clinics, and this option will be available at the Batemans Bay Soldiers Club between the 9th and 11th of September, and I'd be very, very grateful for your active promotion of this opportunity. We've had several walk-in clinics for Aboriginal community members at Bega, Goulburn and Queanbeyan in recent weeks, and I'm really pleased to report that they've been well attended. So most COVID patients are managed virtually in the community. It's of interest really that the Sydney Kids Network have got over 1,000 positive COVID kids on home management virtual care at the moment. And it's just a bit of an aside, but it makes me reflect on the extraordinary changes that technology have brought to how we manage. I can't imagine how you'd cope in a pandemic of this magnitude without the opportunity of virtual care. So we also are very experienced in providing the necessary home monitoring. We looked after over 70 people this way in last year's outbreak, and we're currently managing COVID patients in their homes, monitoring their oxygen levels remotely and checking in regularly, with escalation pathways in place firmly across 24/7 if higher care is required. So then just finishing off then with, Eurobodalla right now. So Batemans Bay and Moruya hospitals are ready for COVID patients with active screening and response plans in place. Both hospitals have isolation areas ready for suspected cases and have transfer pathways well rehearsed for very sick patients who would require more specialised intensive care. So I'll leave it at that. If that raises any more questions for you, as Renata said, there's an opportunity, and we'd be really pleased to hear any more questions tonight or subsequently. So now I'll move back to the Eurobodalla Health Service update. So many of the approximately, I think more than 40 questions we've received to date in the lead up to tonight have got similar themes and really fit into sort of 4 major groupings. There was a set of questions seeking clarity around, what is intended, and questions around language. There's questions around workforce attraction. There was a big group of questions, as you'd expect. The main group of questions was around clinical service delivery. And not surprisingly, of course, questions around the actual building of the hospital and timeframes. So I'll start by addressing the questions seeking clarity of intent and workforce, and then Meegan will answer questions around service delivery, and then Matt will give a good update with regard to the hospital project planning. And I just mentioned again, please submit any additional questions and we'll address them tonight if we can. But if we run out of time, as I said, we'll make sure they're included in the frequently asked questions that you'll receive next week. So in terms of clarity of intent, some of the questions, I'll just read out a couple. So there was a Georgie Raleigh question with regard to, will the new hospital be regional? And then Deborah Stevenson said, why is the Eurobodalla Hospital now being referred to as the Eurobodalla Health Service? Are we getting a new hospital? And if so, will it offer all of the clinical and core services of level 4 when it opens? And then there was a series of questions around what does a Health 1 mean? Okay, so I'll have a good go. When we talk about the Eurobodalla Health Service, we're referring to more than just the hospital. And this is an important context for explaining service delivery, and Meegan will go into more detail. The Eurobodalla Health Service includes our community health centres. It encompasses our non-admitted services such as virtual care, care in the home, community health, palliative care. And importantly, it also incorporates the care we deliver in partnership with other agencies like the Primary Health Network, Coordinaire, the GPs and Katungal. So I suppose in a simple way, you'd say the Eurobodalla Hospital is a key component of the overall Eurobodalla Health Service, which in fact is a key component of the Coastal Network, which in fact is a key component of Southern Health. The new hospital will most certainly be a regional hospital. And right now we're taking the necessary steps to grow level 4 capability, which will evolve over time. This includes the work we're doing right now to enhance emergency care and the close observation care at Moruya Hospital, a $2 million upgrade in itself, to improve the situation as a step to the new hospital. A necessary step in enhancing capacity and capability to look after high acuity patients is a key component of the building blocks to where we will go to get to level 4 in the future. I would say from my long experience in healthcare and the privilege of bringing online 3 hospitals in 2 states, that no new hospital opens with everything fully evolved from day one. Southeast Regional and Goulburn, in our own district, and there are other examples across the state, are good examples of where we are continuing to expand service delivery and meet service complexity. The important thing and the responsibility that we have is to build a hospital that has the capacity and the networked arrangements to safely meet service level requirement and expand over time. Some services will operate at level 3 at completion, but we will work towards increasing the capacity of our clinical services to level 4, and we are doing the groundwork for that now. Okay, so the next one then, from Dr. Holland. Following the recent announcement of a Health 1 facility for Batemans Bay, will Southern provide a Health 1 facility for the population of Narooma? Look, thanks, Michael. Look, that's not currently planned. Given that Narooma has a community health centre, and given, of course, the closure of the Batemans Bay Hospital when the new facility comes online, and obviously our key focus was to establish a centre for community health and related services at Batemans Bay. Hence our gratitude to the government and Minister Constant's recent announcement. So the focus for us, this is a very fresh announcement, not everyone might be aware of it, but a $300,000 allocation to enable us to work with the community and with HI and the ministry and other agencies to actually plan what a Health One would best look like at Batemans Bay. The key thing there would be to make sure, if we possibly can, that the Health One at Batemans Bay would be established and come online well ahead of the new hospital. I think Michael's question, though, is it's a bigger question as well. I mean, I think a broader consideration for service delivery in Southern, and, you know, we're talking about the coast, is an important focus needs to be to grow and enhance community-based services. And whilst I won't go into that tonight, I think that would be an important part of the conversation that we have face-to-face when we next meet over on the coast. Look, moving on to workforce, there's a fabulous question from Fitzroy and Marlene Bolting, and this is amongst several workforce questions, but they've asked what incentives are in place to make the prospect of working in the new hospital attractive. And I think that's just really hits the right chord. It's all very well to have a beautiful hospital, but a key challenge in health service delivery more broadly is staffing. So first of all, I've said thanks for such an important question. I would say, and I have my own experience of this with the new facilities that I've been engaged with over the years, that certainly a beautiful, new, well-marketed and well-managed facility is an attraction in itself, particularly when it happens to be on a beautiful coast, but also when it's part of a dynamic network and with well-established broader partnerships. So that's a start, but that in itself is not enough. A couple of examples I'd give. We're working at the moment with our university partners to strengthen the undergrad and postgrad education that will be available, and well, it's already available, but actually the focus and the centre and in fact a physical presence as part of the new Eurobodalla hospital. We're also working on strengthening the leadership of research across Southern. So both sort of undergraduate, postgraduate education focus and a focus on research and having that firmly embedded is a key consideration in growing our workforce and attracting young professionals. The other thing is the overall framework that brings people to us. We, of course, know, as you would know, that a supportive professional network attracts specialists. So a few of the things we're doing, and it's not just in medicine, but I'll give a medical example. In the last 12 months, we've established medical leads across the district, and already their involvement is helping to build a collegial environment with strong leadership and a focus on clinical excellence, and also a very big focus on advising the executive and the board about what the next key considerations are. Their active engagement in the council, in the clinical council that advises board and executive is already bringing benefits. We're also investing in additional medical leadership for the Eurobodalla. We're working with the Clinical Excellence Commission, who have done a recent review of critical care service delivery in Eurobodalla, and this will assist in prioritising our next steps over the next 4 years. And also we're working to establish a discrete medical workforce plan to prioritise investment across the Eurobodalla and across, in fact, Southern in general, because there is some very significant deficits in terms of medical specialists coming in or living in the district. Look, that just gives, I suppose, what I'm trying to give Fitzroy and Marlene is a sort of a sense that this is a big focus, and it's going to take every bit of the 4 years ahead to make sure we've got this in hand. I would also say that a big thing that challenges us across the district is the issue of staff accommodation, and we haven't got that nailed yet. Obviously, our planning is recognising where staff accommodation would go on the site, but that's not currently a funded part of the project, and that's something that we need to work on, and not only in the Eurobodalla, but across the district more broadly. Look, I might stop there for now and hand to you, Meegan.
Thanks, Marg. I'll kick off around the clinical services. And as Mark has mentioned, the majority of the questions we've received so far have been about clinical service delivery in the new Eurobodalla Hospital and some of the work we're doing right now. So the questions mostly have focused on maternity, paediatrics, orthopedics, intensive care and emergency services, as well as the purpose and operation of the new coastal network. So some of the questions, just picking up on from Marg there, we've had a really good question from Mylene and Fitzroy Bolting, have asked for an example of that's reflecting, the coastal network. How does this operate? Does this mean that resources are going to be directed mainly to Bega, and Eurobodalla patients will continue to travel to Bega for relevant specialist treatment and major surgery? So in response to that question, I'd like to begin by explaining how the network is coming together, and it brings together a range of healthcare services and diverse populations across the South Coast region, extending from the Eurobodalla to Bega. The network's health services have and continue to be designed to address the health needs of its residents and the thousands of tourists we visit each year. So the network brings together similar communities with similar health needs, whilst recognising the unique identity that each of the communities hold. The health services being provided and planned are designed not to compete, rather complement and support greater access to a range of services in the region. So being a part of a network also allows our workforce to grow, connect, learn and develop new ways of working and providing care, which is really important for us to strengthen and grow the levels of care that we will be providing. The Coastal Network hospitals are supported by community health services and partners across the region, as Marg mentioned earlier, and they provide a range of service in and out of hospital. And I won't go over the partners that we have, but certainly highlighting the relationship and the importance of Katungal and Coordinator in ensuring that our people have coordinated and connected care to ensure that they stay well and that our communities thrive. We are striving for better patient outcomes and for our community to receive the best care. Wherever possible, we aim to provide that care as close to home as safely as possible. And sometimes the best specialist care can be further away, be that Bega, Nowra, Canberra or Sydney. The new facility will be a major regional hospital, as Marg reflected earlier, and part of the coastal network. In its own right, the hospital stands at the doorway to our external networks with Canberra, Illawarra, Shoalhaven and Sydney. Our teams have already started some really wonderful work, and it's something I'm quite proud of, in developing new models of care that will support transition into the new facility. The models of care are broadly defined as the way a health service is coordinated and delivered. It outlines the best practice care that is evidence-based and services for the services to a person, population groups and patient cohorts as they progress through stages of their illness, condition, an injury or an event. As Marg alluded to, COVID-19 has and continues to be our greatest teacher. It's allowed us to better understand the multiple ways we can provide care to patients in the home when it is safe to do so, or when they're at their most vulnerable in a hospital environment. Through technology, we're able to connect with specialist clinicians across tertiary referral centres and across our partner organisations to support our staff when and where that is needed. A lot of people have posed questions to us about mental health services, and I think it's important that we address that here tonight. So while the new hospital will not have a dedicated mental health unit, it will include inpatient beds for admission of people experiencing a decline in their mental health, and care of people with acute behavioural disturbance and dependency will require ongoing specialist services, which often are better served in a community setting. Our new tele-stroke service will provide strong networked virtual support and specialist medical guidance to implement world-class immediate care for patients with suspected stroke, regardless of their location. Some of our models of care will determine how we provide stroke care in the Eurobodalla and the wider region of the coastal network by introducing stroke-ready beds and building a workforce to support its delivery. Our virtual models of care are emerging very quickly, as I'm sure you can all appreciate. We're progressing the delivery of in-home monitoring for people living with chronic disease and do not require admission to hospital. And our virtual in-home monitoring services, Marg reflected earlier, will enable us to rapidly respond to COVID-positive people that can be safely cared for at home or in a dedicated accommodation such as a quarantine hotel if that is required. As Marg said, we've received several questions about the level of some of our clinical services and where we will be, they will be when we open the new hospital. In some feedback I've received, a reflection that's really resonated from me from one of our senior clinicians was that it's not about the size of the hospital, but it's the services that the hospital will deliver are really, really important. It's also important that we understand that the hospital is not built to a level, it is the clinical services it provides. The new hospital will include clinical services at a level 4. Some of these services will operate at level 3 at completion of the build, and we'll be working towards increasing capacity of our clinical services to a level 4 as quickly and safely as we can. The level of a clinical service is used to describe the minimum support services, the workforce requirements, and other requirements for the safe delivery of clinical services. So some of those other requirements include establishing our networks and partnerships with a higher level of service, be that Canberra, Illawarra, Shoalhaven, and Sydney, to enable timely transfer for people when that is needed. Each clinical service is planned and developed to the level appropriate to meet the needs of the catchment population, ensuring it works efficiently within the health system as a whole, as well as improves local access to healthcare. The journey in strengthening and expanding models of care for the Eurobodalla region has already begun. We currently have interim works, as Marg alluded to, underway at Moruya Hospital to ensure the hospital continues to meet demand during the planning and construction of the new hospital. Fitzroy and Mylene have asked, when is the upgraded emergency department going to open? So the department, I'll go into that a little bit further down, but the department is progressing in terms of us having some phases of that project delivered by December, COVID permitting access for people to come in and do the work, but I'll allude a little more on that shortly. The Moruya ED expansion, as Marg said, is a $2 million project, so that and the close observation unit that is due to be completed later in the year. The expansion will see a new 2-bed resus zone and a central clinical hub for our clinicians and 4 new treatment bays for low to medium levels of care. There will be an overall increase of 5 treatment spaces at Moruya Hospital, and existing clinical areas will also be refurbished to improve storage and access for our staff. Deborah Stevenson's also posed a question to us asking, there are a number of core services not currently offered by Moruya and Batemans Bay hospitals, which are considered a minimum to support various level 4 clinical services. In particular, a close observation unit as part of an intensive care service, which is critical in a remote area such as the Eurobodalla. Will they be a part of the new hospital? So in answer to your question, Deborah, the refurbishment of the close observation unit is progressing very well. The close observation unit at Moruya will include 7 monitored treatment spaces and is due to be completed in September 2021, pending COVID restrictions and our ability to have those specialist teams on site to complete the work. The close observation unit is an integral step to achieving the level 4 intensive care unit at the new hospital. We have skilled and capable staff to provide close observation unit care now, and should we need to activate that environment, we should be okay to do that with mobile technology. Recruitment to nursing and medical positions is planned and needs to be balanced with timing of service level and models of care changes as we move into the new hospital. I think it's really important that we recognise if we go too early in attracting staff and we don't have environments that attract them to work, we run the risk of losing them and not getting them back. It's also very important that we understand that we cannot open an ICU in the current hospital safely. What we can safely and reliably manage is critically unwell people for a short period prior to them being transferred, whether that to be to an ICU within the LHD or to a tertiary referral hospital. We're currently working in partnership with the Agency of Clinical Innovation and Intensive Care New South Wales, which is exciting, to take the necessary steps to get as close as we can to an ICU level of service prior to moving into the new hospital. That will allow us to accelerate the transition to an ICU model following day 1 in the new hospital. We understand and respect the importance of that, not only to the Eurobodalla, but to the broader LHD network. It's important how we prioritise the models of care and the services we deliver to get the foundations established before we introduce the things we may not have done for a while or maybe before. Heather Cox has asked a question about, can you please tell the meeting how many maternity beds will be provided? Is this more or less than what we presently have available at Maruya? And Mylene and Fitzroy Bolting have asked, will the new hospital provide level 4 paediatric services? I'd like to reassure you all that the new hospital will open with a co-located paediatric and maternity service. The maternity services will gradually increase from their current level 3 to a level 4 service, and neonatal services from the level 2 to a level 3. We're excited about the reintroduction of paediatric services to the Eurobodalla and strengthening our partnership with both the ACT and Illawarra Shoalhaven Local Health District. Contemporary hospital design and models of care enable us to support integration of clinical services. With senior medical leads such as Dr. Holland and Dr. Susie Piper, we can bring together maternity and paediatric services in wards and units that sit alongside each other. This will see improvements in the health outcomes of our women and children as co-located services create a single point of contact with specialist clinicians available for them. The hospital design has been clinician-led, and model of care workshops will continue with this input to further detail practical ways of working for our staff in the new hospital. Work to design the clinical workforce and specialist recruitment strategies, as Margaret referred to earlier, will be developed in greater detail as the models of care are determined in line with the service levels. As we get closer to preparing our move into the new Eurobodalla Hospital, we aim to start recruitment and build reliable networks with other services to support connections with care and stabilisation of our teams. Several people have asked about bed numbers and whether the hospital has been designed in line with the demands created by the future Eurobodalla population and tourist seasons. In response to those questions, the new hospital is a much larger facility than we currently have combined between Maruya and Bateman's Bay for our staff and the patients to deliver and receive their care in. There will be no loss of beds in the region as the new hospital comes out of the ground. The new working environment is going to transform the way we experience healthcare and also how we provide it. A simple example is in terms of the design and the fit out of our new hospital. As you'd probably all know, in our current environment, we have shared bathrooms. In the new environment, we'll actually have rooms with en-suites available to people with ready access and then being fitted out to meet the various needs of the populations that we serve. The way we work will also change an incredible amount, with inpatient units configured in a way that allows them to support what we call a flex up and down arrangement as demand requires. So what this means is the wards can be reconfigured and beds can be opened in a department where the needs for a particular service are required at any given time. Southern New South Wales and the coastal network is aligned with the concept of one team that shares and combines services for the greater good and a greater number of people. I'll hand over to Matt Malone now to provide an update on the new Eurobodalla Hospital project. Thanks, Matt.
Thank you very much, Megan. As I said earlier, I'm delighted to be here to be able to share with you all a project update. I might move just quickly to take the opportunity to introduce some of the other members of the project team that are online tonight, including Catherine Taylor, Director for Rural Regional for Health Infrastructure, Orestes Lomas, Project Director for the Eurobodalla Health Service, Tracy Bates, the Project Lead for Southern New South Wales, and Jim Herford, the Change Manager for Southern New South Wales. So my section of tonight's briefing is to provide an update on the development of the project and some of the achievements to date, including some of the upcoming activities and opportunities that we're really looking forward to commencing. It's important to acknowledge that the project team is planning a hospital that includes services such as an emergency department, surgical and operating theatres, a day-stay surgical unit, paediatric and maternity services, ambulatory care clinic, chemotherapy and dialysis services, and education facilities. This isn't an exhaustive list of everything that's going to be included in the new hospital, but certainly some of the key elements that the team are working on, including into the design of the new facility. As Meegan said earlier, the new hospital will be larger than the combined existing Maruya and Bateman's Bay hospitals. The hospital is also being designed to enable future growth, as the new site will continue to grow over future decades, or the hospital at the new site will continue to grow as that demand changes over time. And that's one of the great opportunities that we have with this project. that we are working towards providing a new hospital on a new site, and that we have the opportunity to start from scratch really, and design something that can form part of a much larger health campus well into the future that continues to serve the community for decades to come. The project planning phase is currently underway. The site master plan has been developed, and the thorough functional briefing process is close to conclusion. You'll notice on the wheel on the right-hand side there, the how to build a hospital wheel. The clinical services plan that has been approved, or that was approved last year, and that has formed a base document for the project. And we've taken that through further consultation with the hospital and the local health district and other stakeholders to work through the master plan, where we've looked at the use of the site and also that functional briefing process. The functional brief that is produced as part of that process informs the design team on how the internal aspects of the hospital is going to function and interact, and other important features such as the hours of service, access to the front of the hospital that might be needed by certain departments, and other key features. It's a very important and fundamental process to go through, and we've had a significant amount of consultation with hospital staff and stakeholders to get to the point where we're very close to the end of that functional briefing process. We've convened up to some 17 separate project user groups to facilitate that consultation, and that included 160 clinicians from across southern New South Wales, but mainly the existing Maria and Batemans Bay hospital staff. The next step in our design process is the production of a schematic design. This design will identify the size and makeup of each department within the new hospital. The schematic design user groups are scheduled to commence next week, and as the planning phase of the project carries on, we'll continue to work through the complex project definition period that includes determining the level of each service to be provided by the hospital. Each step of this hospital planning process is undertaken with the local health district and other key stakeholders in close consultation to ensure the right outcome for the community in the future. We might just move on to the next slide there. I think we've got a project timeline update. So it goes back to those earlier phases of the project where we had the clinical services plan and funding announcement. Late last year, we identified the preferred site for the Eurobodalla Health Service. And in February 21, we commenced that master planning process. The master plan has been, or was endorsed through the project governance process, and since then we've held some significant community consultation with the local Aboriginal community to really inform a culturally inclusive design for the new hospital. Some other key milestones that are coming up, we are expecting a concept design to be completed later in 2021, which we're really excited to be able to share with the community when that's available. And work on site is expected to start in 2022 once the project planning processes are completed, and that once we've completed a significant amount of the design, and the planning approvals are in place to move forward with the project. As touched on in that slide there around the design gem and the walk on country, the project is participating in an exciting new pilot program that's been developed by the New South Wales Government Architects Office. The project is called, or the program's called Connecting with Country. Now, the premise of the program is to provide or to approach the design of public infrastructure in a more culturally inclusive way that can incorporate cultural practice. To help inform this process and this collaborative design approach, the project team held a walk on country with Aboriginal representatives recently, and took place in a design workshop as well that looked at potential cultural design solutions for the project. This consultation process and workshopping will continue into the future, or into the next stages of the design in close consultation with the Aboriginal community. We're certainly excited to be part of this unique experience and really keen to share some of those cultural design ideas when they've realised their fruition. The next steps of the project include the completion of the project planning phase. So that includes the submission of a business case through New South Wales Government and the preparation of the complex planning approval in 2022. That planning application does take a significant amount of time. It's a complex piece of work that takes up to 12 months to produce and involves a lot of further consultation with staff and community during that period. There's a lot of supporting documentation and information that's required to be gathered during that time. And this typically includes environmental assessments, cultural heritage, biodiversity, climate and social impacts to be understood, identified and prepared as part of that planning submission. The start of that process will be the initial application for planning advice through the Department of Planning, Industry and Environment, and that will be issued in the coming weeks, and there'll be certainly some further information when that application is made and released to the community. The construction commencement remains on track for 2022, and the procurement of contractors for the project will include opportunities for local employment through various trades that are required to construct the new hospital. We're looking forward to sharing more of those opportunities when they become available in 2022. That's all I've got in my slide deck for tonight. Thank you all for your time. I'll pass back to Renata or our MC for some questions, and please remember the Q&A box down the bottom.
Thank you, Matt, and thank you to all the panel. I'm going to hand over to Rebecca Bergman now, who will address some of the questions and address those with the panel.
Hi everyone, sorry, just having a bit of a tech slowly load here for us. Okay. All right, Meegan, we've got one for you here. So Martin Carlson has asked, is an orthopaedic service planned for the new Eurobodalla hospital?
Thanks, Becky. Hi, Martin. Thanks for your question. Yes, there is plans, and that will come out in the models of care for orthopaedic services to grow beyond what they currently are in the new hospital. Thanks, Becky.
Okay, so we've got this one, another one for you, Meegan. And actually, Matt, if you'd like to jump in. So what will happen to the Batemans Bay Hospital? Will it be upgraded or downgraded? Remembering that the Bay has a large population of retired and elderly people, it would be disastrous to lose the emergency department and day surgery facilities.
Thanks, Becky. In terms of the Batemans Bay solution, so as you heard Marg talk earlier, what will happen with Batemans Bay, the hospital that currently sits here, I'm sitting there this evening, will be decommissioned, and Matt may be able to talk more about what that means. And the Batemans Bay solution will support some of the services. So in relation to an emergency department and day surgery, the plans for a one Eurobodalla hospital, so to have a single larger facility, will see those services predominantly provided there. Thanks, Becky.
Thank you, Meegan. I've got another one for you. Sorry, Meegan, from Tanya Rayo. Will the paediatrics include surgery or only basic observation for definite non-surgical cases?
Hi, thanks, Tanya. I'm the lucky one tonight. How good. So, Tanya, in terms of paediatric surgery, that is planned in the clinical services plan. As you would appreciate, we've not provided paediatric services in the Eurobodalla for some time now. So that will, as we start to attract and build the workforce and the models of care, that is certainly something that we plan will happen in the little while after we move in, but it won't be straight away. Thanks, Becky.
Thank you, Meegan. Matt, I've now got one for you from Maria. Thank you for this opportunity. Has there been any consultation with Transport New South Wales on the new bypass? And do you foresee any concerns or need for site review?
Thanks, Becky. Thanks, Maria, for the question. Look, certainly the project has been consulting with Transport for New South Wales around the Maria bypass project, and our two projects have put in a significant amount of consultation to ensure that both projects inform each other. Certainly through the bypass site selection or corridor selection process, we were included and involved in that process from a health perspective and an access to the hospital perspective, and certainly through our hospital site selection process, we included Transport for New South Wales in that process as well. So we don't foresee any concerns or need for the site review, noting that we identified the site with Transport for New South Wales in hand. And just to add to that, we continue to liaise with Transport for New South Wales because of how important the access from this new hospital site will be, not just to the Princes Highway, but also to that bypass into the future. Thanks, Becky.
Thank you, Matt. We've just had Suzanne Newnham, just ask what will happen to the current Maria Hospital and the rehabilitation unit?
That'll be a question for me, I guess. Becky, thanks, Maria. In response to that, all of the services that are currently provided at Maria will move across to the new hospital as that is built. The decisions around what happens to those parts of the building will be determined as they decommission those sites.
Great, thank you, Meegan. Do we have any other questions from any of the attendees online? Feel free to type them in the Q&A box. And I'll put them to the panel.
Becky, it's Meegan. Just while people are thinking about questions, I'd just like to acknowledge the community and their advocacy for the project and participating with us tonight. Thank you.
Thank you, Meegan. We've just had Bryony Penrose question. I noted that it is intended to have increased renal dialysis. Will there be nephrology service?
It's Meegan. Thank you. So the question for that is the specialist services can be linked in now for nephrology, and that would be something that would be considered as we work through the models of care. So that's probably as much as I can respond in relation to that right now, but it's a great question. If we can feedback on that through the FAQs, that would be great, Becky. Thank you.
Thank you, Marg, I can just add to that the district at the moment, thanks Meegan, is doing a review of both our cancer planning delivery and our renal delivery. So those services, we already have a director of renal medicine, and we're looking to appoint a director of cancer care. So there'll be further updates on that for the community more broadly, even within the next 6 months.
Thank you, Marg. Gabby has just asked, will the TAFE site be incorporated into the hospital site? Matt, that will be one for you.
Sure, thanks. Thanks, Becky. Look, the two sites are separated by a private parcel of land, so they won't be incorporated to each other. However, we are interested in investigating opportunities to look at ways of activating both campuses throughout the design process. Thanks.
Great, thank you. Meegan, I've got another one for you. We've got Suzanne Newnham has asked just a bit of a clarity around what is level 4 and will there be a chronic pain and management clinic?
Thanks. So yes, there is plans, and we do have networks already for chronic pain management, be that through telehealth, and a lot of the GP services support that model of care. Becky, can you just repeat the first part of that? Sorry. What is a level 4?
What is a level 4?
Yeah, sure. So level 4 services, it depends on the service that you look at. So for an intensive care service, it sort of describes or defines, and noting these are guidelines where we can care for people who have ventilation, so they're on life support. We can often hold those patients where they're clinically stable for a number of days. However, if they need a higher level of care, we would be networking, as I mentioned in my presentation. We would network them to a higher level of service when and where that is required, if that makes sense. Thanks, Becky.
Thank you, Meegan. Matt, I've got one from you, another one from Suzanne Newnham. Will there be other consultation and update sessions?
Absolutely. Look, we're really keen to continue holding these sessions, and I think we need to come up with a way of holding these through COVID, which I think we've done quite successfully tonight. But there's another session tomorrow evening, but beyond that, I'm expecting that we should be able to hold these every 2 months or so.
And I think it's Marg here, Matt. I think if the trick is, I'd hope that the next one would be face to face, but in reality, I'm not too sure about that. And if so, that, you know, would be getting close to Christmas. So it might need to be that we have another one like this before we're actually in a position to safely have everyone face to face. That's certainly our intention. Thanks.
Thank you, Marg. One for you, Meegan. Radiation therapy services, will they be included in the new hospital?
No, so the radiation therapy services in terms of a bunker are not included in the hospital. They're services that we had a review earlier this year in relation to the requirement for that, and we don't have the critical mass to support it at the moment, but that's not to say in time that wouldn't be considered. Thanks, Becky.
Thank you, Meegan. This might be a tricky one for you, Matt, from Brett and Deb. How will the timing of the hospital construction fit in with the timing of the bypass construction, given the disruption that will result with both projects happening at the same time?
Thanks, Becky. Hi, Brett and Deb. That is a great question. And if I had an answer to that, I think I'd be in a great position. Look, we've both of the projects have very important planning approval processes that they need to go through before construction can commence on either of those projects. We are expecting there to be some overlap between the two projects, is our understanding of what the timelines may look like. But I don't really want to talk for Transport for New South Wales right now. As I said, we're expecting to start construction in 2022, and we are expecting some overlap of those projects. But when we know more about that, I think there'll be an opportunity to communicate that to the community. Thanks, Becky.
Thank you, Matt. Another one for you from Mylene relating to the funding of the hospital. She's asked, is it fully funded?
Thanks, Becky. Hi, Marlene. Yes, the project is fully funded. The $200 million that has been announced for the project is committed to by New South Wales Government.
Thank you. Another one from Suzanne Newnham. Will the new hospital, sorry, another one for you, Matt. Will the new hospital also be an education and teaching facility for medical, nursing and allied health?
Thanks, Becky. Hi, Suzanne. Yeah, so we are in consultation with the current education facilities that use Moruya and Batemans Bay hospitals about incorporating those services into the new hospital at the Eurobodalla. So I believe that the short answer there is yes, but we're still working through the detail on what exactly that will look like.
Matt, if I can just jump in there. So it's bigger than what you've just described. So the hospitals will provide opportunity for training for medicine and nursing. We do that now for our undergraduate nursing and allied health workforce. We're working pretty closely with the education sector around looking at school-based apprenticeships and traineeships as part of the program, and also as part of pathways into a career in health for our school kids down here on the coast. The other thing we're working on right now is getting accredited for our junior medical officers to come in and commence training in our current environment. So that is a process we need to work through to be ready for. But once that's happening, we're hoping we can do that before we move into the new hospital. Thanks, Matt and Becky.
Thanks, Meegan.
Thank you, Meegan and Matt. We've just got one last question coming in here. Will the project include accommodation facilities for construction workers during the build? Matt, I'll pass that one to you.
Thanks very much, Becky. Certainly, this is an issue that we're seeing across the coast of New South Wales. It's not something that's isolated to this area. Typically, when we deliver on public infrastructure, we do not provide accommodation or for workers beyond the minimum requirements that we need to for lunch and change room facilities. Certainly, each of the contractors that do tender on this project will need to come up with some clever solutions to how they are going to keep workers in the area overnight, because it is a problem that they're going to need to address. Thanks, Marie.
Thank you, Matt. I'll pass back to you now, Renata. Thank you, everyone, for your questions.
Thank you, Becky, and thank you to all our panel tonight. It's been absolutely fantastic, great information, and really pleased to have your expertise here to share this with us. So thank you to Matt, thank you to Meegan, thank you to Margaret, thank you to Becky for helping us with the panel and the questions. Thank you to the community. As Meegan said, your interest and your passion for the project has actually spurs us along and makes sure that we'll deliver a great facility for the future of the Eurobodalla community and the South Coast, far South Coast region as well, which is absolutely brilliant. Really appreciate that you have joined us. As Margaret said, it would have been wonderful to have this face-to-face, and hopefully we'll be able to do that soon and safely again in the near future. There are many other people online tonight as well that have helped place this opportunity together. So thank you. They know who they are, and thank you to them. We wish you all well and safe in this period of time, and we look forward to connecting with you again in the near future. Good night, everyone.
Thanks, Renata. Good night, everyone.